My job is to intake patients that have been referred by a physician or other referring source that has had trauma to their upper extremity. So usually it's from the mid-humerus down to the fingertip, and it can be any kind of trauma like a crush injury or a fracture or a tendon laceration, or it could be someone that had a nerve entrapment that had a release done, or somebody that has bad arthritis in their hand that had a joint replacement done in their knuckles, or any trauma really to the upper extremity. So when someone is referred, a lot of times I'll start with my evaluation, which will be measuring the swelling or the edema, and then the range of motion, and then the strength or stability of the joint, and then if they have functional use or not. So it might be a manual muscle test, it might be grip or pinch strength to determine where we're starting so that we can develop goals. And then of course talk to the patient to ask them what their goals are, because sometimes it's work related and sometimes it's sport or hobby related. And then I employ techniques in order to help that. So that might mean I'm going to use heat, I'm going to use joint mobilization, I'm definitely going to teach them a home exercise program with exercises or strengthening techniques. I might have to make them a splint if they're an acute injury to protect the things that are healing. It just depends on where their diagnosis is and what their goal for that stage of healing is.
Cindy's very knowledgeable with everything. She's just wonderful. My experience there was great. When you walk in, from the time you see Colleen or Sarah, and they're treating you wonderfully there, it's almost like family there. And then you see Katie, but Cindy is really special, and she makes you feel like part of the family, and you can feel like they really cared what happened with you and how your progress was going.
When I started in therapy over 30 years ago, that people were like, when they were 60, they're like, okay, it's time to get a rocking chair, I'm just going to relax. And now I have 80-year-olds that say, well, I want to be able to water ski. And I'm like, really? And I want to be able to rock climb. And I'm like, okay. And it used to be when we had thumb tendons that everybody was just happy if they could grab their soda. And now they want to be able to text and tweet, and they're using their thumbs for all sorts of things. So as time has changed, it's been very fun and interesting to adapt to those changes as the needs grow with more activity and more vital information that people need in order to get better.